Hi everyone, I'm Zabeh Bhujwala and I've been asked to give a talk on MR and cancer theranostics in this session on spectroscopy and molecular imaging of cancer. So I have no financial interests or relationships to disclose with regard to the subject matter of this presentation. Theranostics or theranostic imaging is a term that is used to describe a combination of therapy and diagnostics, and the whole purpose of such a strategy is to minimize damage to normal tissue to achieve precision medicine. And especially in cancer, where there is so much of collateral damage to normal tissue, this becomes really important and provides hope for precision cancer medicine. So in theranostic imaging, typically some therapeutic cargo, such as this could be molecular agents such as cDNA or small interfering RNA or a prodrug enzyme, or a chemotherapy agent, or a photosensitizer, or a radiosensitizer, is loaded or conjugated to a carrier. And the carrier can be a liposome, or a nanoparticle, or a micelle, or a viral vector. But the important thing is that it is decorated with some imaging reporter for detection with either magnetic resonance imaging or spectroscopy, or nuclear imaging techniques such as PET or SPECT, or ultrasound or optical imaging. And then this carrier is targeted to some specific aspect of the tumor. And there are many targets in cancers that can be used for theranostics. So these could be endothelial cell receptors, they can be cancer cell receptors or antigens. It could be stromal cells. So for instance, fibroblasts play a big role in malignant progression. You could target fibroblasts or macrophages. And also tumors have these abnormal physiological environments such as hypoxia and acidic pH. So people have designed carriers that, for instance, will open up at acidic pH and deliver therapeutic cargo at this in these acidic pH environments or hypoxic environments. And the whole idea is that with imaging, you make sure that the therapeutic cargo is only released at the chosen target. Now, of course, several imaging modalities are available for molecular imaging applications. And most imaging centers, academic centers, have multimodality capabilities, imaging capabilities for preclinical research that include MRI, nuclear imaging, optical imaging, ultrasound, and CT. And of course, MRI, PET, SPECT, CT, and ultrasound are also routinely used in the clinical setting, facilitating translational applications. Now, within the context of other imaging modalities, MRI traditionally has major strengths in structural and functional imaging, and increasingly is finding applications in molecular imaging. Of course, nuclear imaging and optical imaging have great strengths in sensitivity of detection. MRI is somewhat limited for sensitivity of detection. So with nuclear imaging, you can detect picomolar concentrations. And then ultrasound and CT are again very good with structural, somewhat with functional information. And now there is a trend towards developing molecular imaging probes for ultrasound imaging. So you can imagine that these different imaging modalities have different strengths. So increasingly, the carriers or the nanoparticles being used have a combination of imaging reporters. They are multimodal, multifunctional, and so they have both molecular functional capabilities and carry therapeutic cargo for theranostics. So for MR theranostics, typically the imaging reporter generates either T1 contrast or T2 contrast, or chemical exchange saturation transfer contrast, or metabolic contrast. And of course, MRI, MRS can be used to investigate cells and ex vivo tissue and extracts, can be used for preclinical models of cancers. As I mentioned before, now there is this push for multimodal imaging. So now we have PET MR scanners for simultaneous PET MRI imaging. So here is an example of PD-L1. PD-L1 is this immune checkpoint expressed by cancer cells. So here is an example of PD-L1 imaging with PET. And you can see how beautifully the tumor shows this fairly heterogeneous distribution of PD-L1 in the tumor. The kidneys light up, and you can see some in other areas as well. And this is overlaid on this exquisite soft tissue contrast provided by MRI, showing how you can combine these imaging modalities to understand expression of molecules in tumors. I've taken an example of work from Sridhar Nimmagadda at Johns Hopkins. And then, of course, MRI and spectroscopy is routinely used in the clinical setting, and so it makes it very easy to translate discoveries into human applications. So, as I mentioned before, there are many targets in cancers that can be exploited for theranostics. And a theranostic agent is typically injected into the bloodstream. Now, if it is a vascular targeted agent, it is retained in the vasculature. Otherwise, it extravasates into the interstitium and binds to receptors or antigens on cancer cells. So, for instance, you can have prostate-specific membrane antigen binding, or PD-L1 binding, or you can have binding to stromal cells, so fibroblasts express FAP alpha extracellularly, so you can have FAP alpha imaging, or you can have nanoparticles that target the extracellular matrix, or you can have them release their cargo in these physiological environments of hypoxia or acidic pH. So what I've done here is picked 4 examples of MR theranostics. The first example is to show how it is possible to target the prostate-specific membrane antigen that is expressed in androgen castrate-resistant prostate cancer. And this is an example of multimodal imaging combined with Metabolotheranostics targeting a specific metabolic pathway. The second example is of HER2 receptor targeting. So HER2 is expressed by breast cancer cells. And this is a pre-targeting strategy that uses GAD-DTPA to generate T1 contrast. The third example is to show how a Furin enzyme-specific contrast can be generated with CEST imaging. And the last example I've picked is targeting the extracellular matrix, in this instance fibronectin, with ultra-small superparamagnetic iron oxide nanoparticles that generate T2 contrast. So I'd like to start with this first example, which is targeting the prostate-specific membrane antigen. So as I mentioned before, PSMA is expressed by castrate-resistant metastatic prostate cancer, as shown in these images where you see this clear uptake of this PSMA imaging agent by these metastatic nodules. So the nanoparticle we designed was targeted to PSMA, so it had a PSMA binding agent. It consisted of a polyL lysine backbone to which we conjugated a prodrug enzyme, which is bacterial cytosine deaminase. And we picked this enzyme because it converts non-toxic 5-fluorocytosine to this chemotherapy agent 5-fluorouracil, and both the 5-FC and 5-FU can be detected non-invasively by fluorine spectroscopy. We also conjugated polyethylamine to this polyL lysine backbone so that we could electrostatically bind choline kinase small interfering RNA to downregulate choline kinase in these PSMA expressing cells. And the reason we picked choline kinase as our metabolic target to downregulate is that most cancers have this elevation of total choline that is detected by spectroscopic imaging. And this elevation of total choline comes about because this enzyme, choline kinase, which converts choline to phosphocholine, is overexpressed in cancer cells. And so this increases phosphocholine, which is part of that total choline signal detected by spectroscopy. And so you see this increase of total choline in tumors. So the tumor models that we picked for these studies were a high PSMA expressing PC3 PIP tumor and a low PSMA expressing PC3 flu tumor that were inoculated bilaterally. And we used indium-111, which is a SPECT, a nuclear imaging agent, to detect this nanoparticle because, as I mentioned before, with MRI, the sensitivity is somewhat reduced, and so with nuclear imaging, we could detect this nanoparticle in the tumors with pretty high sensitivity. And our purpose for being able to detect this nanoparticle in the tumor was we could then make sure that it had cleared out of normal tissue, was retained in this high PSMA expressing tumor, so that when we injected 5-fluorocytosine that was converted to 5-fluorouracil, this only occurred in the high PSMA expressing cancer cells, generating 5-FU only in these cancer cells and not in normal tissues. And here you can see that because we also delivered choline kinase small interfering RNA, we could pick up this significant decrease of total choline in the tumor. And with fluorine spectroscopy, we could non-invasively detect the conversion of 5-fluorocytosine to 5-fluorouracil in the tumor. And so this was this theranostic, metabolotheranostics strategy for PSMA targeting in prostate cancer. The next example I've picked is for HER2 targeting in breast cancer. And this is actually a pre-targeting bioorthogonal two-component drug delivery system that incorporates imaging. And this is something my colleague Dmitry Artemov has been developing for a few years. So in this click chemistry approach, two click partners are used So the first click partner is used for the pre-targeting approach. Now 20% of breast cancers express HER2. So the HER2 receptor, once it is present in breast cancer, the first line of therapy is to use this antibody called trastuzumab, and it's been shown to be very effective in treating HER2 positive breast cancer. But some of these HER2 positive breast cancers then become resistant to trastuzumab, although they still continue to express the HER2 receptor. And so this is where strategies like antibody drug conjugates, where the antibody carries a chemotherapy agent like paclitaxel, becomes useful. But then this also has an element of toxicity because the antibody keeps circulating for a while in the system. So with a pre-targeting approach, you can take this trastuzumab with the first click chemistry pair and one imaging reporter and make sure that this trastuzumab has bound to the HER2 receptor with imaging and it has cleared out of the normal tissues. Then you follow up with the second click pair, which is tetrazine. And this is albumin with tetrazine and the chemotherapy cargo. So then the tetrazine binds to the first click pair, which is TCO, and it forms these clusters wherever HER2 is present. These clusters get rapidly internalized by receptor-mediated endocytosis, and then this is followed by deconjugation and release of the drug wherever there is the presence of this HER2 receptor, achieving this precision medicine type of approach. So here is how imaging can be integrated. So this is an example where one optical imaging reporter is used for pre-targeting, and you can see it's localized in the HER2 tumor. This is followed by the second click pair that carries the chemotherapy cargo, and you can see that this is also localized in the HER2 expressing tumor. These are two different imaging reporters, so you can identify the pre-targeting and the chemotherapy click pair. So you can take an MRI approach for this as shown here. So now this is a HER2 expressing tumor that has first been pre-targeted with trastuzumab and TCO, followed by albumin with GAD-DTPA and paclitaxel. And here you can make sure then that this has achieved this targeted delivery of the paclitaxel through the change in T1, the shortening of T1 because of the GAD-DTPA. So here is a second example, and this is T1 imaging for Theranostics. Now the third example I picked is a Furin enzyme dependent CEST contrast. And the way this works is that this enzyme called Furin is associated with malignant progression, and it is present in increasingly aggressive cancer cells. So this anti-cancer agent osalazine was conjugated to a cell-penetrating peptide, RVRR, and this anti-cancer agent was then brought into these cancer cells by this cell-targeting peptide. And where there was high furin, the furin acted upon the osalazine conjugate, and with a biologically compatible condensation reaction, turned it through self-assembly into large intracellular nanoparticles that generated CEST contrast. And this is work done by Jeff Bolte and his colleagues, and shows that you can clearly see this high CEST contrast in this high furin expressing tumor compared to low CEST contrast in this low furin expressing tumor. So the high furin expressing tumor showed this really significant accumulation of this anti-cancer agent. And so this is an example of CEST contrast detected furin-dependent theranostics. Now for my last example, I've picked an example of a recently published manuscript where these authors used ultra-small iron oxide nanoparticles conjugated to a photosensitizer called squaring, which also had a fibronectin targeting peptide attached to it. So, and then this linkage between the squaring and the iron oxide nanoparticle was through a cathepsin B dependent binding linker. So these investigators then injected this nanoparticle, and of course the rationale here was that fibronectin is overexpressed in triple negative breast cancer. So they could target it to fibronectin using this peptide, which consists of these 5 amino acids and fibronectin, that is, and they used tumor models that were ER positive, which is MCF7, that had low fibronectin, and MDMB231 that had high fibronectin. So once this nanoparticle was injected, then it went and bound to the fibronectin in these tumors. And so you can see that the high fibronectin triple negative breast cancer has a significant T2 change, as shown by this loss of signal in the tumor. These triple negative breast cancers also have high expression of cathepsin B. And so the cathepsin B then cleaved this nanoparticle to release this photosensitizer squaring that then was used for photodynamic therapy, achieving this extracellular matrix type theranostic approach that was combined with photodynamic therapy to achieve fibronectin cathepsin B specific therapy in the tumor. And so, to conclude, I hope I have demonstrated that MRI and MRS have many diverse applications for cancer theranostics, and hopefully in the near future we should be able to see translational applications in humans of these many novel and innovative strategies that incorporate MRI and MRSI for precision medicine in oncology. And thank you for your attention.